TBIs are commonly caused by motor vehicle accidents involving hitting the head, contact sports, assaults, and falling. TBIs can cause a variety of symptoms depending on their severity, anything from feeling dazed and confused to a total loss of consciousness with memory loss. Phil, who are at higher risk of developing TBIs?
Well, according to the CDC, some groups may be at higher risk of dying from a TBI, such as racial and ethnic minorities, survivors of intimate partner violence, incarcerated or homeless individuals, veterans, and service members. Those veterans exposed to explosive during combat training exercise run a high risk of brain injuries. As of 2015, the VA screened over 727,000 service members for TBI and found that 25% qualifies to be included in the VA Traumatic Brain Injury Health Registry. Of those in the registry that screened positive for TBI, 77% were caused by blast injuries, with over half of those service members reporting loss of consciousness and 40% experienced post-traumatic amnesia. So Heidi, what symptoms are common with TBIs?
TBIs are classified as either mild, moderate, or severe, and the severity of the TBI can be assessed using a CAT scan of the brain. And they can be mild, such as a concussion, with symptoms that can affect one's ability to think, their memory, mood, balance, and focus. The more severe TBIs can also cause symptoms such as headaches, depression, and vision and hearing problems. And sadly, individuals who received medical evaluations for TBIs were found to be twice as likely to die from suicide as the general population. And this is true in the veterans population as well. How do TBIs affect service members and veterans, Phil?
TBI affects a person's ability to find and keep employment. And of the 77,000 veterans who filed for disability, more than half with confirmed TBIs were found to be service-connected. It's quite a bit. For the year 2019, the CDC reported that 5-year outcome for those individuals over the age of 16 with moderate or severe TBI, 22% die, 30% becomes worse, 22% stay the same, and only 26% are improved. Heidi, what treatment is available with individuals with TBI?
So anyone with a TBI would benefit from assistance with coordination of care between the providers of behavioral health, primary care, and specialists. Treatments for TBIs include cognitive therapy, combinations of physical therapy, such as PT, speech, and occupational therapies. Medications such as depressants can help with specific symptoms such as headaches and anxiety. Prevention of the TBI includes wearing helmets when participating in sports that might cause head trauma, and reviewing the medications that could lead to dizziness and falls. Having regular eye exams can help, and participating in exercise programs that improve your strength and balance can also help. Many clients we care for at CHR are at a higher risk for TBI due to a substance use disorder. Providing support to maintain sobriety in individuals with a substance use disorder through therapy and medication-assisted treatment can help these clients prevent falls and avoid TBIs. What recommendations do you have for veterans and service members that believe they have suffered a TBI?
Well, veterans who experience or suspect they have TBI during their service should start by completing the VA TBI screening administered by the VA healthcare provider. If they answer 4 or more of the screening questions positively, they will be registered with the VA TBI Veterans Health Registry and offered compensative clinical evaluation to diagnose their symptoms and develop a plan of care. Non-veterans should speak with their primary care providers following any head trauma to discuss diagnosis testing to identify traumatic brain injuries. Non-veterans should speak with their primary care providers following any head trauma to discuss diagnostic testing to identify traumatic brain injuries.